Well, it's fantastic to see the great British public coming out and having their voices heard. It's also very interesting to see that across the political arena, from what they call the left to the centre and the right, there's unanimity in this. The idea that we have a biometric surveillance state constantly censoring, constantly surveying and monitoring the public, the British public do not want this. So it's fantastic to see that. But at the same time, we know that the people that are in power are quite determined to make sure this happens in an array of ways. So we have to stay very vigilant together.
What methods do you think they're going to use next? Because the idea that it would stop illegal migration has just frankly dissolved.
Yeah, so Keir Starmer's recognised that the "it will stop the boats" argument has fallen completely, and it's just ridiculed. So at his
Yeah.
speech at the party conference, he said we're going to have NHS digital. That's the big idea, and what it's going to do is it's going to reduce waiting times, and it's going to get you to a GP no matter where you are around the country. But of course, we know that's another spin, because the issue of not enough GPs and not enough time, and the issue with A&E, and the issue of too many bureaucrats and not enough frontline staff, but also a lack of efficiency, and the big question of what is to be done with healthcare in Britain, and whether we should have more of a mixed approach to it like they have on the continent in Europe. These things are not going to get resolved by a digital ID. And the big concerns, of course, with the health digital ID is what we've seen already when there was an attempt to impose a mandate for jabs for people who'd been working on the front line, 100,000 NHS staff. We'd already lost 45,000 care workers from it. The idea that we have a biometric state with a digital ID which nudges and forces and coerces people, it's unacceptable.